Good afternoon. My name is Beulah Pollard, and I am deciding to address a topic that is often overlooked in our society today, and that is mental illness and how we are treated as a people. Mentally ill people are treated with certain types of stigma. They come with it, it's okay to abuse them, it's okay to mistreat them, violate their rights, and so forth. I personally had a situation where I was in an emergency room, and I spoke with the nurse and told the nurse that I had not been on my medication. I was in a manic state. And I explained this to him, and I asked him to speak to the doctor and get me something for it. He would not speak to the doctor. And my whole thing is, if I had come in with a medical emergency and couldn't breathe, he would have spoken to the doctor then. But I come in with a psychological emergency, and they're not trained properly on how to handle them. So he just pretty much hauls me off to this room and leaves me there. Okay, I attempt to go out and smoke and calm myself down, and the security guards are there telling me that I can't do that. But at this point in Georgia, you have to call at 1013, and only the doctor can do that. So if I had not seen a doctor, there was no 1013 calls, and there was no safety hold call. So I could go where I wanted to go at that point because I was frustrated with the situation and their lack of knowledge and incompetence. I continue, to voice my rights, and they get agitated with me. So I'm there in the hospital chair, and I'm sitting there and I'm listening to the security guards talk about how they abused another mentally ill patient, and they're saying motherfucker this, motherfucker that, motherfucker the third, and I get tired of hearing it because at this point I've decided to try to go to sleep, and I'm tired of hearing it. So I let them know in a polite manner that I can hear their conversation, and would they please cease and desist or take the conversation elsewhere, which is my right as a patient, as a paying customer in this hospital. So one of the guards starts getting totally belligerent with me, screaming all sorts of vituperations, asking me who am I gonna tell, and he says some more stuff, and he says I can run tell that, and just being completely ignorant. So we get into an argument, and I say something that the guard can't handle, and now they want to put hands on me. Well, the nurse who I had talked to previously, who was aware of what was going on, gave them permission to put their hands on me. So they put their hands on me, and the battle ensued because I have a right to defend myself at this point. Because again, I'm not committed, I'm not on a hold, and the doctor has not seen me. So I have every right to say, don't put your hands on me. And the only reason they wanted to put their hands on me was because I said something that they could not handle. So we end up in a battle. They end up pulling my hair out from the root and twisting my arm and dragging me on the floor, this dirty hospital floor, dragging me through the ER to this little green room where they lock me up, take my eyeglasses, refuse to give them to me. And all of this is supposed to be acceptable treatment for mentally ill patients. I think not. And I know that I'm not the only one who has suffered at the hands of incompetent hospital employees. They need to be more educated on how to deal with psychiatric patients. This is all I have for you right now. Thank you.